Hi, my name is Tamika and I am a student at WVJC, and I am going to show you today how we do scheduling within the medical field. So for this, I will be using Microsoft Office Word documents. Once we get here, after it loads up, of course, it's going to show up and you can use either a template that has already been created or you can use a template that you create, which for this, I created my own so that you can see the different ones. So we have first time specific, first come, first serve, and wave. And those are the ones we will be going over today. For our first one, we're going to do time specified. Now, when you do time specified, you have to make sure that you are on time or at least 30 minutes before scheduled time. If you come late, it is a chance that your doctor will not see you. So when we're going to schedule them, we'll go in and we have to know what they're getting checked for. So you put the time, the patient's name, the doctor that they're seeing, and what they're here for. Now, usually something like a yearly checkup does take a little bit longer, so you make sure you schedule enough time before you schedule your next patient and have enough time for them to be seen. Okay? Now, our next one, we are going to go to wave scheduling. Now, for this particular one, most practices that use this are used in a primary care physician's office or something like that along those lines. It is where we schedule 3 to 4 patients, sometimes 2 or 3, who are being seen for the same thing, but they schedule them every 30 minutes. So let's say we have our first time is at 9:30. So that'll be our first wave. We'll have 3 patients coming in and each one is getting checked for a hypertension checkup. Now, the way that they get seen is the way that they come in. So you'll have, if let's say Monica was the first one to come in. So she will be scheduled first and the lather after. Then you won't schedule your next one until 10 a.m. because you know it's going to take about 30 minutes to get through all 3 of those. Then you'll go to your next one and then you'll have Tamika or Charles for diabetes. But you know, in order for that wave, that what medical equipment to have out and available ready. Okay? And finally, we will have our first come, first serve. So for first come, first serve, this is more done in a clinic or in a emergency room. So now with this, you got your times. Usually they are in 30-minute increments. That gives them enough time to get them seen and triaged. So with this, you have to also make sure that it's whoever comes in first, they get in line first. But it's also depending on if their problems are severe enough. If they have chest pains, fever, and a broken arm, you have to figure out how to triage that first. Who would go first? You would use your broken arm first and he would get scheduled first. If you use your, then you'll go follow through the chain. It'll be chest pains after because that can be a sign of a heart attack. And then you can have your fever after because they can wait. Well, that's all for today. My name is Tamika. Thank you for watching How to Schedule Patients Within the Medical Field. See you guys soon.